Hi, my name is Lynn Kuhn. I'm a licensed professional counselor in Portland, Oregon, and I thought it would be nice to record this video to give you an idea of what happens in a first therapy session with me. So I send an intake form that you bring into the session, and we use that as sort of the starting point. It has some general contact information, but what it also has is information on your reasons for coming to therapy, anything you might have tried so far, if you've seen a counselor before and what worked and what didn't, and a symptom checklist. And we talk about that in the beginning, and then I just kind of ask you what brought you here. And sometimes that's very easy for clients. They can open up and just begin talking. And for other people, that's not so easy, which is perfectly normal. We're not all outgoing and able to say what our struggles are or why we're here, or to relax immediately with a stranger who's asking you to share sort of difficult information, perhaps. So, in that situation, then I'm more interactive and I might ask more questions. I really take the lead from the person sitting in front of me. And what's ultimately important for me is that you get to know a bit about how I work and to see if you would be comfortable working with me, because statistically, therapy works best if the client and the therapist have a good working relationship. So it's really important for me that clients know that at the end of the first session. And what I want to know at the end of the first session is I want to have a good understanding of what brought you in so that I know and can tell you whether I can be of help or not. Then, if there's time, we also talk about goals. What is it that you would like to have happen? How would you know that things have changed? And you might not know in the first session, but it's good for us to keep that in mind because we know then where we're headed, and you have a way to measure progress. Another thing that we might talk about is how you work best and what you want in terms of insight about how the issue came to be or what caused it or why it might be happening versus tools. Sometimes people just say, I just want tools to cope. I want tools to know how to deal with this situation. And I work within that framework with the client of what their need is, but really kind of what I offer is a combination of both. I think insight is important, and I think having tools can be important too. So I take my cue from the client in terms of what it is they want, and I bring also what I think is important for the client to make permanent changes. So then at the end of the session, we talk about what makes sense going forward. What kind of a need does the client have in terms of how often they would like to meet, whether it feels comfortable for them and they'd like to continue, or whether they want to take some time to think about it. So it's really very client driven. I hope that helps you get an idea of how I work. If you have any questions or would like to learn more, please feel free to email me or call, and we can talk further. Thanks.